When we set up a patient in Care Response to receive an assessment questionnaire by email, the system will send an email to the patient, like the one we're seeing on the screen at the moment. So this is a test one, so it's got the word test there, but it's addressed to the patient. Dear Mr. Jetmoney, I'm writing to ask you kindly complete a short online form before your appointment. Information from this form is an important part of your assessment, and it can help ensure you're recommending the most appropriate care. Completing this online now will save time during your visit that may be used more productively when you come in. This form can be found by following this link. It gives a link to the form and it's signed off the name of the practitioner, and it gives an alternative way of accessing it. The text at the bottom here may vary from organisation to organisation. When the patient clicks on the link, it should open their web browser and it will take them to a login page within Care Response. It's patient assessment consent. It gives their name. It says, thank you for helping with this form. Before we can display it, we need you to confirm your identity. So in here we're going to ask the patients to place their date of birth before they continue. Should they wish to, they can opt out. So they can say, I prefer not to complete any further assessments. They can click here and stop themselves receiving any more assessments. It also states that anonymous data from our files is occasionally used for research and educational purposes, but if you'd rather be excluded from this, please indicate here. So patients have control over what their data is used for. This patient saw the date of birth of the 5th of April 1964. There we go. Continue. If that's correct, currently patients in the systems are actually asked to participate in a PhD study, and they can read the form and say, yes, I want to participate, and they can opt not to participate if they don't want to. And they're then taken to the pre-examination questionnaire, and in here they may select where their pain is. So this person's got pain in their left leg. How long have they had the pain? This is exactly the same as the pre-examination questionnaire that is visible to you on your screen of Care Response. I'll just flick through some of these questions, putting some answers in down through here and through the question at the bottom. This bottom question is called the Bournemouth questionnaire. Some versions of Care Response or some practices may prefer to use the MIMOP rather than the Bournemouth questionnaire, but they have a similar function. And the patient then would say, submit answers. If they've done it correctly, they come up with this splash screen, and it gives them the option, if they're a patient of a chiropractor, going to the General Chiropractic Council's webpage, and they have the option of clicking here to go to the clinic's website if they choose. So that's the patient journey. The form they've completed will now appear in the work lists of the practice for which sent it.